We need more money in research. We need more doctors who are willing to investigate this. The only one who's ever investigated it. Hopefully what we're going to be doing with this and this podcast, as well as the research already published, is getting people to go, holy moly, this is not like anything else. And if this is true, if what they're saying is true, it's going to change medicine and we need to study it.
Welcome to the Alternative Flight Plan Podcast. This is where we explore healing paths your conventional medical provider may never mention or even know about. Finding solutions, creative solutions to complex problems is critical in healthcare and chronic disease, and I've stepped out of the ready room and into the treatment room to share some of these with you. I'm very excited to have today's guest on. Holly is a dear friend and colleague, and we work together. So I'm very glad to have her on talking about fascial counterstrain. Holly is a naturopathic doctor and an acupuncturist and a certified level 1 fascial counterstrainer, although she's much more than that, but she does have that piece of paper, with 25 years of experience in the healthcare field. She's also the brainchild behind the Bridgeback Project, which works to provide access to veterans and first responders for treatment of chronic pain and PTSD. Today, Holly and I are going to dive into Counterstrain and, more importantly, into a recent study that she published in Military Medicine, of all things, looking at the efficacy of fascial counterstrain for chronic pain and post-traumatic stress. So strap into your ejection seat. It's time to taxi to the catapult and get airborne. Holly, welcome.
Thank you.
I am so excited to have you here.
I'm excited to be here, Kristin. This is fantastic.
Yeah, so you've been doing Counterstrain for 25 years, and it was about a month ago that we finally have our first study on the efficacy of Counterstrain. So we're going to get into your background a little bit. I think a lot of that's appropriate. But first, let's just talk about Counterstrain and the study and help our folks that are listening understand a little bit more of why this is so important.
Sure. So I actually started doing Counterstrain about 15 years ago. I was 10 years into practice already. And I found that there were patients getting this modality done, and they were able to achieve a level of healing in a different way that I was not able to achieve with 10 years of experience as a naturopathic physician and acupuncturist. So, of course, being a curious person and an investigator, I had to go experience it for myself and was very stunned at the results I got after a single session. And this was back in like 2009 when there was just one class on fascial counterstrain, and it was the lymphatic venous visceral class combined. And I immediately needed to know more because I went in for musculoskeletal issues. I had been a collegiate and then professional athlete and had acquired my fair share of head injuries, and I actually woke the next morning realizing that my digestion had changed. So I was like, what happened? And started my dive into it and have not come up for air since. Still learning, still improving, still growing, and I will never stop. And that's what the cool thing is about this technique, is it's the most specific physical medicine modality ever in history. And I don't say that lightly, having studied acupuncture and Chinese medicine for my entire career as well. The level of specificity we're able to reach with Counterstrain far surpasses anything I've ever learned. And again, it's still evolving, having just really been discovered and produced as a physical medicine modality just since the early 2000s, late 90s maybe.
I came to Counterstrain because of Holly. I was watching a continuing education convention for the American Naturopathic Association, the yearly CEU thing that they put on. And she gave a talk, and I was blown away. It's like my intuition bells and whistles went off. I'm like, I have to find out more. I dropped Holly an email, and she had responded by the end of the day, which is very unusual for very busy practitioners. And I was encouraged by that. If this person cares enough to give a lecture at a convention and respond to an email from a complete stranger, I just graduated, it's brand new, then this is somebody that I need to go meet and see. And so I made a trip over to Paulsbo from Seattle, where I was living at the time, to go see her clinic, watch her work. And then by the end of the day, I had signed up for some appointments to get treated. So I wanted to experience it myself. And at that point, like, I am hook, line, and sinker. Like, there's no going back. And ever since then, I'm like, well, how can I work in Holly's clinic? So tell us a little bit more, because I do have, and I know how I would answer this question, but I want to hear how you'd answer it. I have a lot of people come and ask me what's the difference between something like massage or rolfing or even acupuncture. What's the difference in fascial counterstrain and some of these other things that we consider hands-on manual therapy?
That's a difficult one to answer, because my answer is this: there is no comparison. You can't say it's like myofascial release. You can't say it's like bone therapy or Feldenkrais or craniopsychotherapy, which are all very gentle ways to help the body to heal. It's also not like a stellate ganglion block for PTSD or a vagal nerve stimulator for PTSD, because those are working on one single spot. So if we're looking at the stellate ganglion and we're doing a block at one point, what if we treated every single nerve that goes to every single organ in the autonomic nervous system? So that's the level of specificity we're talking about here. We don't have just one option now. We don't have just a vague and general treatment, which, again, studies have shown those things are helpful. We have specific. We can treat the nerve roots that go to the heart or to the eye or to the liver for the different parasympathetic, sympathetic sides of the nervous system. And then in addition to that, that's one thing is we can treat nerves. What if we can treat individual nerves in the arm or arteries in the arm or muscle chains in the body and bones and blood flow into and out of the spinal cord, second and third order neurons in the brain? There really isn't another technique that does anything remotely similar to that with the level of specificity. And being able to diagnose and treat that it takes a few years. And it takes some time, and it takes some hands-on and practice and mentorship to really get people to the point where they're at, I would say, an expert level of delivering that technique and modality. And it takes a dedicated practitioner as well, because there's a doctorate level of understanding that needs to happen with the physiology from the top of your head to your pinky toe. And, way easier, no offense to, please don't take offense if you're an orthopedic surgeon and I say this, but if you're a knee guy, all you got to do is knees all day. It's just knees. And you're really good at that knee. And yeah, you may know how it articulates with the rest of the body, but really you're focused on that knee and you're really, really good at doing whatever it is to that knee. Arthroscopic surgery or replacement, that's your thing. You rock at it. As a expert level fascial counterstrain practitioner, you really do need to know the entire body, because you might have knee pain that's coming from the middle of your back. Or you might have back pain that's coming from your knee. And as a counterstrain practitioner, you need to be able to diagnose that, figure out what tissue is that. Is that an artery that's causing that problem? Is it a series of things? Like, is it superficial fascia and also the adipose surrounding the nerve roots as they exit the spine? So we have the ability to get that specific.
Yeah, I continue to be blown away. So I'm going to back up in a minute here. You mentioned earlier that when you first started this, there was one class, and I think there are 12, somewhere between 12 and 14 now. And then with the 4 brain classes that will be published and available in the coming years, I mean, we're going to be upwards of 20 classes. And then he's splitting bone into 2 classes. Anyway, that's a long conversation of saying, that's a lot of time in the classroom, and the level of specificity as you break down the lymphatic venous system into 2 separate classes. It takes a total of 48 hours to educate somebody on. As I learn more about the structures in the body, let me share a specific one. I just took the second central class, and I learned about the vagal inflammatory response, which I probably should have known in the past, but I don't think I really appreciate it. And as Brian, the instructor, was walking through what the vagal inflammatory reflex is and how it affects the body and the immune system, the fact that it's treated through arteries in the gastrointestinal system is a little bit mind-blowing. And then the fact that dental ligaments have an impact on the vagal inflammatory response is still something I'm trying to wrap my mind around.
And it's really it's that the nerve and the artery actually travel together. So you're not using the artery to treat it. You're treating the things that go in parallel, and the nerve sitting right next to it will affect that artery, right? So it's actually brilliant how he was able to figure that out and really have a major effect on cytokines in the body. And that's one of the reasons why the Bridge Project exists, is to study things like this. Okay, so if that's true and we can treat the vagus inflammatory reflex, we need to prove it. We need to do pre and post blood measures, blood labs, and see, well, what's happening in the body then? If we can prove before and after we have an immediate drop, then people are going to start paying attention more, because we need more money in research. We need more doctors who are willing to investigate this. I being the only one who's ever investigated it. Hopefully what we're going to be doing with this and this podcast, as well as the research already published, is getting people to go, holy moly, this is not like anything else. And if this is true, if what they're saying is true, it's going to change medicine, and we need to study it.
Okay, so this is a good opportunity for you to walk the listeners through the study and talk about how it came about and what the actual results were. What'd you find?
I can actually say that now. Isn't that exciting?
Yeah.
For years, I've been like, well, it's promising. That's all I can say. Okay, so 2016 or 17, I had a patient walk in and say, why don't people know about this? And my response was, we're all artists. Okay, so the people who are really into this are into it, and they're going to learn every last thing they need to know about it. And as new stuff comes out, they're hungry for it. But it's one person at a time. It's not an organization. Okay, so we're all learning this after we've already gotten our degrees. We're separated from our medical institutions, and we're all on our own. So we're the artist working with one person at a time. There are a few exceptions, like Kyle Kusinose teaches at SDSU, teaches anatomy and physiology. But in general, we're all by ourselves, and none of us have a ton of money. So if I had the money, I would do research on this, is what I told this guy. And he's like, well, what if I gave you, and then I said, it needs to be a nonprofit. This needs to be something for the people, not something that is just for one person's economic gain. So he said, what if I gave you the money to start a nonprofit? And I said, I would do it. I would do it. If I had the time and the money, I would do it. And so that's where it started. And so we started the Bridge Project. And I also knew that my impact on the world needed to be more than something that was just musculoskeletal. Having been an athlete my whole life and knowing how much I love working with sports medicine and how great that is, that wasn't saving people's lives. It was helping improve the quality of their lives, and I still love working with athletes. However, what I did know anecdotally was that I had patients coming back and literally saying that the treatment that we did together, that I helped take care of them through, saved their life. And I don't say that lightly. I would never say I saved someone's life, but people have come back and said this treatment has saved their life. And I knew that if I was going to do research, I wanted to make an impact on their lives and on the world at the same time. I was very naive when I said that. And I had no idea how difficult it would be to say, I have a physical medicine modality that can literally help treat PTSD and drop the scores. And so I talked with some psychologists. I talked with some people who had done research already on PTSD, and knew that the outcome measures I needed to use were the gold standard for PTSD, which is the clinician-administered PTSD scale for the DSM-5, otherwise known as the CAPS-5, which is a psychologist-administered test. I also learned how to provide that test myself through a training. And then I also did self-reported outcome measures to measure things like depression, anxiety, satisfaction with life, pain, and overall impression of improvement from the perspective of the patient. Those were going to be things that were relatively inexpensive, meaning I had to pay a psychologist to administer the CAPS-5 who had experience working with first responders and veterans. And then the patients themselves or the subjects themselves could do the self-reported outcome measures on their own. And again, we were doing this with low to no budget here. Okay. And I had donations coming in from people who were personally impacted by what this had done in their lives. People who had experienced the change that this can make were the ones who gave us the money. And I had no grants. I had no university backing me. My own university that I graduated with my doctorate in naturopathic medicine wouldn't help me. And I had a lot of doors slammed in my face. I went to imaging places that basically said I was nuts, wouldn't do the pre and post measures. I even tried the people who do SPECT scans, and nope, I'm, they looked at me like I had 10 heads. So a lot of people were like, basically, you're nuts, thinking you can do this. And so I was just like, okay, what's the next step? And I just kept plodding along. And at the same time, I was trying to work out what protocol I wanted to use.
That's a lot of information. How did you, because it's not all nervous system, you're doing some other stuff. Like how did you start that protocol?
Well, at the time, so this was 2017 when I conceptually started working on this project, I had already had several patients who I'd treated the autonomic nervous system on. And they had, like, I'll give you one example, but I'm going to give you a trigger warning in advance that this can maybe be triggering for some people. I had a patient who came in and she had been captured and held in a room and repeatedly raped by 4 men, and then they dumped her in a ditch to die. And she survived, obviously, and she had survived that trauma with severe symptomology afterward, and was several years out from that, but it was very difficult for her to just live life. And I said, I feel like I have the ability to help you with that. I want you to bring someone with you that you feel safe with, because I'd only met her once. I said, you don't know me, but I'm offering to help you with this. So she came in and she laid down on the table. And as we worked, she stopped in the middle at one point and she looked at her aunt who was with her and she said, he's here, he's here. And she literally was having a flashback of somebody in the room with her, who had harmed her repeatedly. And we just took a few breaths and then she said, okay, keep going. And, we continued to work. And at that point I was working kind of just by the scan in the body and not with the diagnostics we have right now. And it was still, when I got to the last quadrant of her body that needed to get worked on and finished the last treatment, I was in the middle of the last treatment. She takes a big shuddering breath and as she lets it out, she goes, you're done, aren't you? And I said, yes, that was the last one. And she said, I could feel it leaving my body. And all 3 of us just began to cry. And it was extremely emotive. And I could not charge her after that visit, which seemed like to me like such a gift to be able to experience someone's life changing in that moment. And I knew when I was given the opportunity, hey, would you like to research something? And, when that question came up in my mind, I immediately thought, I have to help people with PTSD. I have to. That's a calling. It's a raison d'etre, if you want to say. It's something that I feel like if we can help people with their physiological response to trauma to get back to life again, to restore their lives again, that's what I want to do. So I already had that autonomic nervous system aspect with 0 brain stuff when this patient happened. And this was I don't even know when it happened, prior to 2017. And it also had some first responders and veterans come in with somewhat similar responses. And it was a very clear, this has to be what I research. Again, being very naive, that there are no other studies done on a physical medicine modality treating PTSD and its symptomology. So there are no peers to peer review.
So that's important. There's no massage, there's no Rolfing, there's no Feldenkrais, there's nothing. Like this is the first of its kind.
No clinical research at all. None.
Yeah. I do think it's funny that you continually, and I've seen it myself, as I as I really get an appreciation for using the workflow to diagnose the body and treat appropriately, watching people get off the table in a completely different frame of mind than when they laid on the table. But we're crazy, right? It's not real. Okay. Oh my gosh. I think where Counterstrain really is important in my work here in Port Townsend is helping people with chronic pain. There are so many reasons for chronic pain. A lot of the population here in Port Townsend is elderly. It's a large retirement community. And so people are coming in their 70s, 80s and higher who have been dealing with things their whole life. And they, heard a rumor about me, that I can help. And whether or not I'll be able to dial back the intensity on something they've been struggling with for 80 years is uncertain. But I think it's at least worth a try to keep things from getting worse. And a lot of people can manage, but if it starts getting worse, that becomes really problematic. Number one, because they can't move as well as they want to. And number two, because it really impacts your mental health when you're aging and you're feeling your mortality and now you can't move and you have all this pain. So, it becomes really important in my work for helping people deal with chronic pain. And the other piece of that is the mental health aspect, where people are aging and they're in their 50s and 60s and they're going through these transitions in life. They're retiring, they're watching their children go and have grandchildren. And we just went through COVID and a giant pandemic. I guess pandemic by definition is giant. But these things leave indelible marks. But the thing is, they're not indelible. Like, we have modalities, and Counterstrain and the Bridgeback Protocol are a big part of educating people, and that the body still can heal. And it has the bandwidth, provided we remove the obstacles to cure and do the right intervention. And the Counterstrain has been a big part of that for me.
I looked up studies on how blood flow will increase to the alarm centers in the brain, like the amygdala, for example, and it will then decrease to the area of the prefrontal cortex where we make decisions and where we come up with ideas and where we have judgment. So cognition is diminished and alarm is increased. Okay? So think about that for a second when you look at somebody who's been through trauma and they're in a field where they need to be using their brain, like being a law enforcement officer or being out in the field as a military operator. You need to be able to use your brain and you need to be able to make judgments. And if you're over alarmed because you have increased blood flow to that area, that is not good. So this is also something that we incorporated as part of the protocol. And then as far as the research paper goes, because it was a small sample size, I had only so many words I could use and only so many references I could use. So my paper that is published now is probably less than half of what it started out as. And I wasn't even able to include all of the things that we actually treated. We focused on the autonomic nervous system in the paper, even though the protocol involved more than that. There was also not enough research to back up that we could actually treat those things. So we could only publish what we could back up with research. So yes, it's been so far very well received, the paper as it's come out. We definitely showed a dramatic drop, an 18.7 drop in the CAPS-5 score, which is a p-value of 0.0017 compared to the waitlist controls, which for those of you who know what p-values are, that's extremely statistically significant. And as far as I know, and I'm obviously not PubMed in my head, but what I looked at in the research, there wasn't anything that is quite that impactful. But again, small sample size and waitlist controls versus active controls. So there were some limitations to our study too, which means we really need to do research and get larger sample sizes and get better outcome measures where we're measuring functional MRIs before and after treatment, and we're measuring blood markers and active controls. So there's a lot more that needs to be done. This is the beginning of this work, but the results are astounding. And imagine also if we're able to do this work with psychedelic-assisted therapy, which shows huge amounts of promise, and also needs larger studies. We need more money going into psychedelic-assisted therapy as well. So imagine if we took both of these and were able to treat the physiological effects of trauma. Because in my view, what PTSD is, and also what a lot of depression, anxiety, and different psychological things are physiological problems, at least in part. So if we can affect the physiology of a person who is suffering and change the way their body responds to things and how they're able to interact with the world, that's a game changer, especially if we're able to do it without having to re-traumatize people. So one of the therapies that is used for PTSD is to basically expose them. It's called exposure therapy to the trauma again and again and again. And imagine if you have something in the back of your mind that's reminding you all the time of this thing that happened to you, or the thing that you saw or witnessed or experienced, but it's constantly there and it's just like on. That is there as a physiological response. It's there because your body's like, I could die, and it's reminding you that you could die all the time. So if we can turn that noise down and allow the physiological response to be quieted, then we have somebody who's now able to go out into the world and experience the world in a way that they did before they experienced their trauma. Now, in some cases, this has happened since birth, because I've worked with some trafficked individuals who have had trauma since they were born. They're still able to, after this, experience the world in a different way. It takes a lot longer, and they need more therapy involved with that, which is definitely a part of trauma recovery for sure. And also, if their physiology is now functioning differently and they're able to experience relationships with people in their lives and loved ones, and going to the grocery store, something you and I might take for granted, but some people can't do it until this comes along in their life and they're able to experience life in a physiological, more neutral state. It's a gift to be able to give this to people.
I'm going to have you pause there, because I want to stress that so many people come in and they say, I'm anxious or I'm depressed, and they think it's all up in their head. And in a way, yes, but like, they think it's purely an emotional thing that can only be affected by doing emotional type work. And I think part of what I've been trying to get across to people is how much of what they experience is purely physiological. Like, I've had people who show up and are anxious and have no reason for being anxious. Well, there's a reason you're anxious, because it's physiological. It's not because you had some sort of trauma. And the other point I want to make is these types of modalities that we do that help take the edge off of people. Like, if somebody comes in and their volume is at 11, how are they going to meditate? How are they going to integrate talk therapy or somatic therapy? So I think one of the major benefits of dialing down the intensity of what they're experiencing is because it helps them integrate all the other things that they're doing.
I 100% agree. And as you know, working with a lot of military veterans, if there's a lot of hypervigilance going on, because that's what had to happen to survive in the field, right? When you're an operator, it's, and I don't know from personal experience. I only know from people who I know and patients who I've had. You definitely want to make yourself available to your full capacity to make decisions and your full strength at a moment's notice. I mean, you get distracted and you die, or somebody else does. So if we can get a patient who has that, the experience of trauma that has affected their ability to operate, and get them to a more neutral state again, so they can instantly access that. Because if you're in a state of hypervigilance and that's on all the time, you can't access it. It's like your muscles are already flexed, and now you try to lift more, it's very difficult to. So we want them to be in a physiological neutral state. And I've had patients come in before where they're like, I also can't feel. So I had one guy who was a Marine, and then he was a rescue firefighter. So he did all the dangerous rescues and stuff. And he was on the table, and we were kind of joking around about our kids. And I was saying how when a commercial comes on about a veteran reuniting with their family or their dog, I cry every single time. And he was laughing, and he's like, I'm the opposite. My kids look over at a sad movie or something sad comes on TV, and they're like, look, Dad's not crying again, and everybody else is crying. And he said, I can't emote. I just don't have the ability to do that anymore. And he's like, I know it's sad. I know that I should have an emotion there, but I just don't. And this was an hour-long visit. And as I was finishing the visit, he sat up off the table and he started to cry. And I was, for just a split second, I was like, is he going to be mad at me or is this going to be a good thing? I don't really know. And he just hugged me and he was crying when he said, thank you for bringing my ability to feel back. So imagine that, this is a guy who is so used to experiencing the trauma and having to be on for that situation that he's unable to go the other direction and really experience emotion. And within an hour, and it didn't even take very long, right? It was like within an hour, he felt like the ability to feel had been restored to his body. That's major.
It's huge. And wouldn't it be cool? I had a podcast with Jill Richards, acupuncturist, and she works a lot with veterans from a 5-element perspective. And she would love to see veterans before they go out into the field. And I agree, because so many of us come to this work with our own accumulated baggage already. I just wonder how it would change the post-service picture if we were actually able to chip away at some of this before they even got there.
Yes, and also right, Kristin? So what if you now were in the military, knowing what you know, and you were in the field with the operators, and they went out and they experienced something that jarred their nervous system and their brain, and then they could just lay down on the table. You could work on them for an hour, so they would then be back and ready, right? So what if we trained corpsmen? What if we trained medics to do this? And we had a specialty that these guys could be out in the field with our military operators so that we can keep them in tip-top shape. And they're then allowed to use their brain in a way that they couldn't otherwise. And that goes the same for, anybody who's in a profession where they're continually exposed to trauma. This could be really helpful. Like, what about Doctors Without Borders? What about surgeons? What about healthcare workers who are frontline and in an emergency room and constantly exposed to trauma, and it can't help but affect them? What about all of the psychologists and psychotherapists who are getting secondary trauma by hearing about things that are extremely disturbing on a daily basis? These people we need to take care of. And one of the things you and I actually have talked about is, how do we help take care of the healthcare people? How do we create a healing environment for the healers? And of course, I use the word healer with great reservation. And that's my own issue. I feel like I was in an environment from my young 20s where I feel like using that word is a little bit loaded. And I know it's a very popularized word, but I feel like we're vessels and conduits, and we're messengers. And I'm not healing anybody. I'm just bringing the message through. So I'm more of a helper. But what if we were able to help the helpers, or help create healing environments with people who are in the healing arts? Because we need to be able to keep going. We need to be able to continue to provide care. And in order to do that, we need restoration. And I feel like it's the same for the operators in the field, and the same for the frontline workers. How do we get to all these people so that they know that they have this ability? And when it comes to that, also with the world of sports medicine, I know this seems like a weird segue, but for me, being a retired athlete, and you as well, you and I have both been through significant amounts of physical trauma in our sports backgrounds. I would love to reach those people who are like us, because there's so many of them out there who just think, I'm now broken because of all the shit I did, or all the sports I did when I was younger, and I just have to live in this broken body, and it's just going to slowly get worse. No, I'm here to tell you, no. That is not true. Listen to Amy Griffin's podcast on the Counterstrain movement, and she describes a little bit about one of her friends who had an experience with Counterstrain and how it changed. So we can get to these people if they know that we're able to help them. And of course, yes, it can help the current professional athletes, and that's great, and they can continue doing their job. But being my age, I'm much more interested in people who've already gone through it all and are retired and are now like, oh, I guess I just have to live with my cognition issues because I've got head injuries, or I have to live with, getting my knees and hips and arms and legs replaced one by one, or my back, or whatever it is. It's like, no, let's give you that body back and that life back.
And I wonder about all the athletes that aren't household names that are suffering in silence because maybe they played lineman in the NFL for 3 years before they had to retire because they their cognitive decline and everything was too significant. There is so many applications for what this offers. I'm chuckling a little bit because I loved being an athlete, and I do kind of miss being, maybe not Iron Man, but that was a lot. But I've often said that if Counterstrain existed while I was competing, I may have never retired. So maybe it's a good thing I came to this later, because I'd still be knocking it out for 25 hours a week doing training. Okay, so you have presented this to at least one organization. I am just fascinated with how conventional folks are responding to something that is so out there.
Well, so the dynamic healing discussion group that was started by Stephen Porges and David Hanscom in 2020 is the group I presented to, and it's fairly international. There's a lot of researchers and providers from around the world. Well, most of them are in the U.S. that are on. Psychologists and therapists are on there, as well as physicians and surgeons. Like David Hanscom is a retired orthopedic spine surgeon who wrote the book Back in Control. And a lot of it is about different modalities that can be used to help tune the autonomic nervous system so that your pain is experienced in a different way, or you're able to cope with pain and realize that it's a message. And I don't mean to speak for him or anyone else, because I know that there's a lot that they do on that dynamic discussion group. And I've listened to many of the presentations over the years. And it's really quite fascinating because a lot of them are mainstream MDs and researchers that are really wanting to bring to the world a new way of healing. And they even did a lot of work on COVID, post-COVID fatigue and post-COVID symptoms as well. So I was very interested to present to that group. And I've had some of the people who listened to it contact me. I don't know if Stephen Porges actually listened, because it was apparently, according to one of the guys who listened, he said, the most well attended of all the sessions he's seen. But there were pages of people watching that I couldn't see because I was, like this in a Zoom, and I was just presenting, so I didn't know how many people were watching. But I hope Stephen Porges was watching, and I hope Bernie Siegel was watching, because they're both part of the group. Because we need people that are influencers like that, who have a presence in the world to learn about this and then experience it. And once they experience it, then they need to present it to the world, because nobody knows who I am, and that's great. But if I'm able to reach somebody who does have influence in the world, and heck, I'll come to you and provide the therapy, right, so that you can experience it, because your voice, you person with influence who might be listening to this, is what's going to help catapult this into the world. And how are we going to scale this, right, Kristin? Because you and I have talked about that as well. Is this scalable? It's scalable if we're able to give grants and scholarships to providers who have the ability to take this on. Because shoot, if I looked at it right now, I'd be like, I don't know if I can do this. That's a lot of money. If I'm looking at 15-ish classes at, $800-900 a pop, and sometimes you need to take it more than once because it's a lot. It's like drinking from a fire hose. Each class is like drinking from a fire hose. And I have multiple examples of wonderful providers who would be excellent at this, who have the brain for it, because you have to be able to understand exceptionally unique amounts of information in one 24-hour period, which is taught over 3 days. They don't have the money. They're a single mom or dad with 3 kids, and they're trying to, do their job seeing one patient at a time. They don't, it would take years for them to be able to take all the classes if they only took 1 or 2 a year, because they can't afford more than that. So that's what the Bridgeback Project wants to do too. Not only do we want to give grants to patients, but we also want to give grants to providers so that they can learn this. And we also want to raise money to do research. So we've got all of those things in mind. And now you and I have been talking about how do we provide a healing environment for clinicians. So all of that.
So that's one of the reasons I love Bridgeback, because it's not just, hey, give money and then the money is given to vets or first responders for treatment, but the fact that you want to do research, which gives back to the bigger medical community, and you want to support other practitioners, which helps expand the network and the availability and the access for this. That's really important. The challenge there is I hate asking people for money. I'm in full disclosure, I am on the board for Bridgeback, and it's something that is a passion project. It's one of the reasons I'm actually with Holly at her clinic a couple days a week, because I heard about Bridgeback and I'm like, I have to be part of this. The challenge is getting money. So I'm just going to take a moment to say, hey, if you're one of those people who says, thank you for your service and you want to give back, we would appreciate if you would hike on over to the Bridgeback website, bridgeback.org, and give us even a small donation is going to help us do all the things that we've been talking about.
Yes. And if you give $600, you're giving 3 treatments to somebody who needs it. And I agree with you. The thank you for your service, while that must sound nice to you, it would be even nicer if somebody said, thank you for your service. How can I donate? What do you recommend?
Yeah. Well, there's lots of veterans organizations out there that are definitely worthy, but this is a unique one, and it's one. I'm gonna go back a little bit. You were talking about influencers, and Tony Robbins has actually gotten some counterstrain, and he talked about it in his book, and I can't remember which book it was. I'm a little surprised that counterstrain hasn't gone further based on his rave review of what he experienced.
Well, I can tell you from my perspective what that's due to. I think when you look at Tony Robbins and his influence, you're going to see he is really speaking to the layperson who wants to do research and get their own care. So I would guess that individual practitioners across the country may have gotten some patients from reading his book. However, in the healthcare field, nobody gives a rat's rip about Tony Robbins. This really needs to be like on a Andrew Huberman podcast or another healthcare influencer who is a doctorate level influencer, because the medical field is not going to listen to Tony Robbins. They're going to listen to somebody with an MD or a PhD. And they're not going to listen to an ND either, because we don't have as much influence in the world. And that hopefully will start changing. But there's still a half of the world or so that doesn't even think we're real doctors and haven't gone to medical school, which they just don't know. And, I feel like I published in Military Medicine, which is a military medicine journal from Oxford Academic. It's, not JAMA or a New England Journal of Medicine, but it definitely has an impact that a naturopathic physician was able to publish in Military Medicine Journal. And hopefully that will wake some people up and say, okay, wow, this is legit. Because if you look at the editorial board, there's not a single naturopath on there. It's people in the military with medical backgrounds and research backgrounds. And they looked at this and they were like, wow, this is worthy of our publication. Let's do this. So we want, people with influence in the medical community to pay attention, because that's where we're going to get the influence into the future, is medical research.
If this is interesting to you and you want to, check it out for yourself, just reach out to me. Hello at meridianpassagewellness.com. There's a contact page on my website, meridianpassagewellness.com. You can contact me on Instagram. You can contact me on Facebook. It's very easy to find me, or you can, call the number that's listed on my website. But I offer a free 15-minute consultation. It's 15 minutes for you to ask questions, and then we can get you set up. The really cool thing about living here in the Pacific Northwest is Holly talked about some of the other practitioners, Ellie Majors, Shannon Arndt, who are involved in the Bridgeback. They're here in the Seattle, Whidbey Island areas. So not only am I located in Port Townsend and Paulsbo, Holly's in Paulsbo, Emily's over in Whidbey Island, Shannon's in Whidbey Island, and there are some other providers who are in Seattle proper. Sophie Paco comes to mind. So you have access to a really high level of skill of a provider in the Seattle area. And if you're down in somewhere like Portland, you have access to Counterstrain Portland and a bunch of other providers who are down there. So there's no reason not to find somebody. Get on counterstrain.com, find a provider in your area, and just go check it out. As far as expectations for a first experience, what I do is a lot of education. And when I'm with somebody who's been working with me over time, generally we're just having a conversation and we're talking about the weather and everything else. But for that first session, I like to educate people on what it is I'm doing and the specificity of it. And sometimes that can be overwhelming. And so I tell people if I'm talking too much, about the vagus and the vagus inflammatory reflex, to please tell me to shut up. We can talk about the weather instead. That's fine. But I like to give people information on how their bodies work. So number one, they understand it's not their fault. And number two, they understand that I'm doing something to help right the ship. And so not only are you getting a treatment, but you're getting a glimpse into how your body works and a little bit on why Counterstrain is effective. It's like, it's not magic. I love it when people call me a magician, but it's not magic. It's science. It's physiology, anatomy. And so I think what you do is you get an appreciation for how complex your body is and the fact that we're doing something very concrete to help make it better. We are getting close to the end of our time, so I want to provide people with some resources. Holly, take a minute or two and share with people how they can find you, find more information about Counterstrain and Bridgeback.
Okay, so element7wellness.com is my private practice that Kristin also works with me here. Bridgeback.org is the nonprofit organization that we also both are a part of. I'm actually working right now on a personal website where people can reach me and learn about all the different aspects of what I have to offer the world, including speaking. I've spoken internationally and nationally and taught for different organizations. So there's going to be a landing page for that shortly. If you look at, it will be linked with my other the other websites that I already told you about. But also you can look at, if you want to find a practitioner near you, bridgeback.org has a practitioner lookup. So does counterstrain.com. And so does counterstrain.com. Those are all different ways you can find a practitioner near you.
Awesome. I want to point out also that the Bridgeback website has a link for the Counterstrain Movement podcasts, which is an invaluable resource if you want to learn more about Counterstrain and you want to hear about some folks' experience with how Counterstrain made such a big impact on their life. The Element 7 Wellness webpage under, I think it's services, has a page on what Counterstrain is, as does my own website, Meridian Passage Wellness. Under my services, I have a little write-up on what Counterstrain is. And if you follow those links, I'll take you to counterstrain.com and the Jones Institute website with counterstrain.com. Anyway, you can find me at all the social medias, Dr. Kristin Barnes on Instagram. Alternative Flight Plan is on Facebook and LinkedIn and oh my gosh. And obviously the podcast available on Spotify and Apple and all your major podcast outlets. Is that enough for social media for a moment? Anyway, hey, if you like what you heard here, please like, subscribe, share, all those things. And I think out of all of those, share is most important, because if somebody needs to hear this, maybe you sharing it is going to help. So, Holly, any last words before we go into the pattern and bring it back for a landing?
LFG, Kristin.
That's right. Let's fucking go. Awesome. I love it. I love working with you. I love Counterstrain. And it's hard to tell whether I love psychedelics more than Counterstrain. It's not fair to ask. Anyway, it's going to be my life's mission going forward. And I don't ever anticipate stopping the learning when it comes to peeling back the layers on Counterstrain and healing the body. So with that, thanks for listening. And we're going to take it into the pattern and land on the carrier and go down to Mid-Rats and get a Barney Clark. So thanks for listening. And we'll see you next time.